Every year, the Australian Healthcare and Hospitals Association honours a person who has contributed to health systems research and health policy making in Australia. And we do this in the name of Dr. Sidney Sax, who was really one of the leading thinkers in health systems research and health economics. This year, I'm delighted to announce that the honour is being awarded to Vicki Wade. Vicki Wade is a senior cultural lead on the End RHD Rheumatic Heart Disease program. But prior to that, she worked very closely with the AHHA on a project called the Lighthouse Hospitals Project, which aimed to make a difference in the cardiac care provided to Aboriginal and Torres Strait Islander peoples across Australia. One of the important things to know about Vicki is that she is an Aboriginal person. She's absolutely devoted to improving the health of her people, and she does so as a specialist cardiac nurse. She does so with humility, with grace, and with significant insight into the way we can make the health system better and more equitable for all Australians. So I think AHHA members across the country will agree with me that she is a fabulous choice for the 2019 Sidney Sax Medal.
The Sidney Sax Medal is awarded annually by the Australian Healthcare and Hospital Association to an individual who's made an outstanding contribution to the development and improvement of the Australian healthcare system. Dr. Sidney Sax was an outstanding leader in Australian healthcare policy, development and public health research over a period of 40 years. And not only that, he was also one of humanity's true gentlemen, and for that Australia benefited. Dr. Sax made what is probably the greatest contribution to the Australian health sector and Australian public with the development of Medibank, the predecessor of Medicare. Dr. Sax also established and led the Hospital and Health Service Commission from 1972 through to 1978. So tonight's recipient of the medal that bears Dr. Sax's name has also made an outstanding contribution to Australia's health service, and like Sid, has done so in a consultative and respectful but influential way. The 2019 Sidney Sax medalist is Vicki Wade. She taught the Lighthouse team much, including how to slow down and how to be present. And I'd like to invite Dr. Rob Grenfell from CSIRO, who was previously the National Director of the Cardiovascular Health Team with the Heart Foundation.
Not only has Vicki mentored and nurtured a huge cohort of young Aboriginal Torres Strait Islander nurses and health workers and public health workers. That's the important stuff. You've not just nurtured and supported and assisted those in doing that, but you've actually nurtured me, and you've actually also nurtured all of us, Vicki. So I thank you profusely for that. And no award's actually going to be good enough to give you what you actually deserve for what you've done for that. And I look forward to what you're going to do with RHD.
I would now like to ask Vicki Wade to come forward and receive the 2019 Sidney Sax Medal.
People of the lands we are gathering this evening. This land is sacred land with its ancestral, ancient ceremonial grounds containing bora rings, where once proud warriors celebrated ceremony, dance and law. I know my Nyoongar ancestors are dancing with the ancestors of the Turrbal people on these ancient ceremony grounds right now, and looking down on me tonight proudly as the first Aboriginal person to receive the Sidney Sax Medal. I would like to dedicate this year's medal to all Aboriginal nurses who work tirelessly every day to influence the healthcare system to reduce inequity and disparities for their people. It is not easy being an Aboriginal person working in a predominantly white organisation built on complex hierarchical structures that often perpetuate the cruel racist policy against our people. Being a child from a mixed race, I had a black mum and a white dad. That was black nana, white nana. I learned from a very young age how to walk in the both worlds. I believe this has helped me in my health career. I can sit down quite comfortably with traditional owners, community, talk about, and Rob, talk about cultural obligation, our rights, reciprocity, culture law and co-design. I can sit down equally comfortable with cardiologists, academics, bureaucrats and politicians and talk about clinical guidelines, research methodologies, health planning and redesign. It has not always been smooth sailing, however. When I was first notified that I had received this honour, thank you Andrew, I was saying, is Andrew playing a prank on me? I was a bit nervous, a little bit apprehensive and feeling, am I worthy enough? What it made me do though, it made me reflect on the last 43 years in health and look at what I have achieved. I started my nursing training in 1976 as a shy, awkward 17-year-old girl. The first month into my training, I was summoned to matron's office. Those nurses know what this means. As I entered matron's office, I was very nervous. Is your mum, Joan Eggington, the one that works in the local nursing home? Yes, I said in a low, shaky voice. Well, you won't finish your nursing, you people rarely do. End of conversation. I turned around and left the room, and as tears welled up in my eyes, I thought, yes, I will finish my nursing, I'll be a great nurse, and I'll do great things. I often thought which was the most powerful thing to make me want to survive, and sometimes I think it was it matron's cruel words, or was it my mother's voice in my head saying, be proud of who you are. The price you put upon your head will be the price others put upon your head. Both, I believe, kindled the fire in my belly, and it could be related to Newton's third law too. With this behind me, I started to recall all the great things I have achieved and contributions I have made, and I become less anxious and more self-assured, and I felt worthy and proud to be the recipient of the Sidney Sax Award tonight. I tell these stories because they shape who we are. It's our lived experience, and they're important to the contributions that we make to the health system. In finishing, a quote from another great woman of the screen, Mae West. We only have one life, but that's all we need if we do it right. My life as a nurse manager, a policy maker, an academic, cultural advisor has been challenging, yet extremely, extremely rewarding. I have worked with amazing inspirational people, many in the room today. They have helped me achieve my goals. Those who know me know I'm not comfortable with the status quo. I acknowledge all my brothers and sisters, aunties and uncles. I also acknowledge the strong health advocates that have walked beside me and them. Please let's all walk together as equals to help close the ongoing insidious health gap for First Nations people of Australia for once and all. Thank you. I'm the Senior Cultural Advisor for Rheumatic Heart Disease Australia. Rheumatic Heart Disease Australia it's a small unit within Menzies, so our head office is in Darwin, and it's got a team of 8 people where we get some money from Commonwealth to do a lot of work in communities. So there's a lot of education for communities, education for health professionals, plus also we do some guideline developments. At the moment we're developing the third edition of the Australian guidelines for rheumatic heart disease, acute rheumatic fever, and I have a wonderful program called the Champions for Change program, where I have people with the lived experience of rheumatic heart disease.
At the Champions for Change program, what's happening there?
Yeah, what we've done, it's we've taken those that have the lived experience, so people with the lived experience of acute rheumatic fever or rheumatic heart disease, and also the carers, so those that care for. We have a few of the mothers whose children have rheumatic heart disease, also Aboriginal health workers, Aboriginal health practitioners that look after people, but mainly it's making sure that the community voice is heard, and those living with acute rheumatic fever, rheumatic heart disease are listened to, and that they're part of the overall health policy, the overall health picture. So it's really important that people understand that what it is to be living with rheumatic heart disease, and how can we better help, better understand and better help, so we can direct health resources, health policy, education to those that have rheumatic heart disease.
Vicki, so you're from 4 generations of healers, including your daughter.
Yes.
Can you tell me a little bit about how that's shaped your career?
I think that's had an enormous shaping of my career from an early age. I can remember Mum going off to look after people and me saying, look, I want to be like Mum. And her mother, Nan Lily, looked after the Aboriginal women on the missions and in the reserves in West Australia, so down southwest of Perth. So she did this all without a formal education. So I say that Nan Lily was a paediatrician, a gynecologist, all of this with no degrees at all, denied education. And then my mother became an enrolled nurse, so I was very proud that Mum took that step to be an enrolled nurse. I became a registered nurse, and then my daughter is now a doctor, so she's training to be a GP. So this healing and this overwhelming cultural obligation to look after people and to make sure that particularly Aboriginal people, health is looked after, to me that's was there before I was born.
So it's always been a part of you and a part of your family and your family's heart and yours as well.
Yes, it has.
Yeah.
It's been in our heart, and I, quite early in my nursing career, I did start to favour, I suppose, looking at those people that have heart disease. The heart fascinated me. I can remember going out to places when I was younger, and I would say to people, well, they say, what do you do? And I say, I mend broken hearts. So I'd have all these people lined up saying, oh, I've got a broken heart, mend my heart.
Literally.
Yeah, not literally, but I think the heart, it did fascinate me from an early age. So most of my nursing career and my career has been looking after the heart disease of all Australians, and in the last 20 years particularly of those Aboriginal Torres Strait Islander people with heart disease.
Speaking of the heart, why is rheumatic heart disease more prevalent in the Indigenous community than others?
Well, rheumatic heart disease, it's a condition, it's a heart condition, so it's a permanent condition of the heart, and it's the heart valves that's affected. And what happens, why it comes about, is that you'll have a group A infection, so it's a streptococcal infection, and it's predominantly of the throat, and it can be skin sores. So what happens is your body has a autoimmune response, so it's an abnormal response to this group A streptococcus. And what happens then is that predominantly Aboriginal and Torres Strait Islander people are having this autoimmune response, so this abnormal response where it will affect and damage tissues that are healthy tissues. So tissues such as your joints, so you will have like an arthritis, so there will be lots of joints affected. You will have a central nervous system effect, so we call that Sydenham's chorea, where a young person might come in and they'll have shaky movement. The teacher at school might notice that they have just their hand movement, their writing's not as well. Some of the young people get really embarrassed and shamed that they have these shaky movements. So so it can affect the central nervous system. But the thing is, if it continues, it will affect the valves of the heart, and this leaves a permanent damage. Whereas the joints will come and go, and the Sydenham's chorea, so the central nervous system, will go, but unfortunately the damage to the heart stays. And this is predominantly in Aboriginal and Torres Strait Islander people. In Australia, 94% of those with rheumatic heart disease, and we have over 6,000 on our register, are Aboriginal and Torres Strait Islander. The others are Pacific Island, refugee, but mainly rheumatic heart disease is seen in poor countries, developing countries, not developed countries like Australia. We saw rheumatic heart disease in Australia years ago, and we know that Kevin Rudd has had his valves replaced from rheumatic heart disease. So this is the era where we saw people with rheumatic heart disease in the broader population, but it's been eradicated in mainstream Australia. But Aboriginal, Torres Strait Islander people, particularly in remote areas, they've got the heavy burden of the disease.
Since you've joined RHD Australia, talk to us about some of your accomplishments in terms of reducing the number of people with rheumatic heart disease in the Indigenous community.
I think some of the things that we're doing quite well in rheumatic heart disease is that we're doing a lot of education. So you'll be surprised at how many people in Australia do not understand what rheumatic heart disease is. They've never seen a case. There's some doctors, particularly those doctors that work in urban settings, that have never ever seen a case of acute rheumatic fever. So we do a lot of education. We've been to some of the remote areas in West Australia, in South Australia. We will do education to doctors, to nurses, to Aboriginal health workers. We will teach community also. So I think some of the work that we're doing that will hopefully close this gap in rheumatic heart disease is around education. There still needs to be a lot of work in education. We're also developing some resources for community, to empower community to be able to know what acute rheumatic fever is. We've produced a wonderful DVD for school teachers. So often the school teachers will be the first ones to notice that a child has acute rheumatic fever. Also, we've got a Champions for Change program where we've got over 30 people now across Australia. It's the only program in Australia that has got this people with the lived experience. And next year we'll have a camp where we bring them all together so they can talk around their experiences, and we will give them a little bit of professional development. So if they want to go out and talk to their local community, if they want to go and talk to other people in workshops, that they've got the confidence. We want them to grow the confidence because they have the lived experience. They know what it's like to have rheumatic heart disease or acute rheumatic fever.
You were part of the NAIDOC week last year. Yeah, talk to us about the Because She Can weekend.
Yeah, the NAIDOC
campaign.
week, I think that was one of the greatest themes I think we've had for NAIDOC, is Because of Her We Can. And I think there are some wonderful women out there in communities, and there's some wonderful Aboriginal women in these communities that can really help get the messages across and be leaders within their own community. And often I will draw on my strengths of what I've learnt from my mother and from my grandmother to be able to say to champions and to say to other people that if you tap into your cultural knowledge and use this to help people to understand the difference between an Aboriginal person having rheumatic heart disease and a non-Aboriginal person having rheumatic heart disease. People need to understand that there is a cultural difference, and if we practice healthcare without seeing and enabling and embracing culture, we won't ever close that gap. So we really have to look at who that person is that has rheumatic heart disease.
What was the turning point in your career?
I did a lot of my original nursing and health work in mainstream health. So I was a student nurse the old way through the hospitals, and then I professionally developed myself because I could see the younger ones coming through. They were going to universities, getting degrees. I had done the hospital-based training, so I knew that I would have to then go to university. So I did a diploma to start with, then I did a bachelor, and then I thought to myself, well, I still need to do a little bit more. If I want to make a difference, I have to educate myself. So I did ended up doing my master's, which was good. And I think the tipping point for me was I did all the training in mainstream health, and then I could hear my mum's voice saying, you have to now go and put all this work, all these things that you've learnt, go now and work in the community and make a difference in the community. So then I started to look at being a leader in Aboriginal health.
It's definitely had a big change amongst a lot of people.
Yeah, I think one of the main things is being able to walk in the two worlds. So having that strong sense of who you are and self-identity as an Aboriginal person, being strong in culture, and also being able to sit down with a cardiologist, being able to talk to a cardiologist, sit down with an academic, with a research professor, and being able to talk research. So I think the thing for me is I have this ability to be able to walk in the two worlds and make a difference in two worlds. And this is sometimes hard, and often people don't realise what it means, but I think coming from that mainstream health, learning as I did up through the hospitals and learning the hard way, I was a nurse, became a nurse educator, a clinical nurse consultant, and then applying my cultural knowledge to what I've learnt through Western health and Western medicine, combining these, I think was the magic ingredient.
There is still a big health gap. Can you tell us a little bit more about what we can actually do as a whole country to really bring it together?
I think the health gap, we haven't lessened the gap really. It's quite significant, the gap between Aboriginal and non-Aboriginal people. There are a lot of good people doing a lot of good work, and we are seeing some good outcomes in terms of child mortality, which is fantastic. The heart disease, so heart, we're not seeing a great big work done in closing the gap in heart health. But what I'm seeing now is a lot more people interested. We have a lot more people coming on board for rheumatic heart disease and to combat rheumatic heart disease. We've got now the CEO of the National Aboriginal Community Controlled Health Organisation, Pat Turner, who now has come on board with us in a end rheumatic heart disease strategy, which we're working with a coalition of peak organisations working on a roadmap to eliminate a rheumatic heart disease. So what I'm seeing now is hope, because there's a lot more people joining in partnerships. And I think we're being a lot more smart about now using a strength-based. What we need to do is to tap into the strengths that's already there in communities. So there are a lot of good programs that are already running. So what we do is to enhance these programs, to tap into these programs. We don't need to create a whole new program if some program is working well at the community level. There's a lot of communities who have got the solutions themselves and are working hard. So there is a lot of hope in terms of partnering with a lot of key organisations and really using this strength-based approach to be able to tap into things that are working well.
What do you think are some of the greatest changes that you've seen in terms of education in the Indigenous community to make this happen?
I think there's a lot more people listening to Aboriginal voices now. We have our first Aboriginal Minister for Indigenous Affairs, so Minister Ken White, Minister for First Nations People of Australia. So this is good. We've got voices at national levels, at high national levels, and we've got some really good, what I've been seeing, some young people coming through that have gone through to Year 12, gone through to higher education, and their voices are being heard. I've been to a few youth summits lately, and there are just some wonderful young people coming through that are being able to tell their stories, and people are listening to them. So I think there is more listening to the Aboriginal voice.
Let's talk about culture. So tell us, where did dream stories come from?
Yeah, dream stories is our way that we describe the creation of the world. So for us, there are many stories across Australia. So there are different tribes, there are different nations across Australia. For us, we have Wagle, who's our rainbow serpent, who created the waterways. Some other creators are Biami, who created the waterways and the rivers, the mountains. So the Dreamtime story is our creation. So it's the way, and it's very important, Aboriginal people's connection to land. And this is reflected in health also, because a lot of the people that have got rheumatic heart disease or heart disease live in remote areas, and when they have to be treated, they have to come off country to be treated, and often they're away from family. So the connection to land is very important. So I think one of the ways forward too is to see if we can have access closer to these remote areas, because Aboriginal health is very holistic. So it's mind, body, spirit, but it's also connected to land and who we are. When I look across Australia, the beauty of being having a national position is that I get to travel to other states and territories and have a look. There are some wonderful work being done by local people with the help of partnering, some wonderful cardiologists coming into community to help. So I think there are pockets of good work being done. The New South Wales has done some fantastic work in terms of our vascular health program and chronic care programs. West Australia is doing some fantastic work up in the Kimberleys. Northern Territory, there's 2 communities in Northern Territory that are working really well. Maningrida, who has the highest rates of acute rheumatic fever in the world, they've got training their Aboriginal health practitioners to do echo screening. So the Aboriginal health practitioners screen the community, so the community can see then if they've got a rheumatic heart disease. And it's empowering the community, because at that time the community is being educated and they feel good about themselves because they're helping their community. So there are pockets of really good work being done across Australia.
So what does it mean to be a Sidney Sax recipient?
It means a lot to me, and I'm feeling so humble and privileged to have been awarded the Sidney Sax Medal. It's I do a lot of the work that I do for my community without wanting any recognition or praise. I work a lot within teams and help motivate teams, and I don't, like big note or want any accolades myself. So I think, having worked for 30 or more years now in the area, that people have seen the work that I'm doing. I'm not one to go out and seek any accolades at all. So in order for somebody to notice the work that I'm doing and give me this award is fantastic. I think it's also wonderful. I had a look at those previous Sidney Sax Award winners, and it's so humbling to be awarded this with some of the professors that I've seen and worked with over many years and admired them and held them in great esteem, and to think that I can have an award equivalent to some of those people that I held in great esteem is fantastic. I think being an Aboriginal nurse, I can remember when I first started nursing, the matron knew my mum and said to me that I'm not going to finish nursing. So I finished nursing and went on to be a specialist in cardiac nursing, and have worked across Australia now for many years at high levels in improving the heart health of all Australians and Aboriginal people. So I think as an Aboriginal nurse coming through with not much help at the beginning, and really a lot of sort of discrimination and racism within nursing initially, to overcome those barriers, to get myself through the education, and then to make a mark in heart health. It is a well-deserved recognised. So I really am quite humbled to accept that award.
Absolutely, I think it's very well deserved, and I feel honoured to be listening to your story today.
Thank you.
Yeah. And what last words would you have for any young Indigenous person who's looking to change and improve the healthcare sector within the community?
Yeah, we really need a lot more Aboriginal people coming through the health sector, and this is all aspects of health, from allied health, nursing, Aboriginal health practitioners, through to doctors. We need to increase our workforce. We're no way near parity on these, and I think it makes a big difference because of that lived experience and the culture, being able to translate the culture and help communication in healthcare. Having an Aboriginal person there is very, very important. So I think we do need to actively seek out our young ones coming through to take up a position in health, and particularly in hospitals. I think it's really important that when Aboriginal people do go into hospitals, that they see a lot of Aboriginal people working, and it may make a difference between an Aboriginal person staying in hospital or leaving. So it's what they say is we need a lot of black faces in hospitals. So it's really, really important that we do actively seek people working in healthcare positions.
Congratulations once again on winning the Sidney Sax Award. Thank you very much for your time.
Thank you.